Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. I'm Jean Sarnowski, and on today's program we're going to learn a little bit more about the benefits and exactly what is adult day health. And we're lucky enough today to have with us Mary Devlin, who's the manager of the Public Health and Wellness Department at the VNA. So thanks, Mary, for being here. I appreciate your time.
Thank you, Jean. Thank you for having me.
So I always like to start with the viewers getting to know who you are a little bit. So if you just, how long have you been with the VNA and what was your interest in public health?
Okay, well, I started with the VNA about 11, almost 12 years ago now. That's my second time around. I was with the VNA once before, but came back because the VNA is a great organization.
Because you missed it so much.
I did. But this time what attracted me back was the community pieces of this position. We have programs in the community. Of course, the VNA does home care, but we have other programs that can assist people to stay safely at home in the community, like our adult day health centers.
Okay, so we'll get right to it then. The adult day health program, for those viewers that may not know what adult day health is, we'll start with the basics of that.
Okay, adult day health program is really a program for seniors and persons who have some type of disability that they can go and they can join others that have the same common interests and sometimes the same limitations that they do, and it's a day program. They have refreshments, they have a hot meal, and mostly they have socializations throughout the day. So it's not a program where they're going to go and join a group of other people and sit and watch TV all day. They're going to actually be very active with the other people, engaged in conversations, engaged in some games. There's always a puzzle going on. Sometimes there's, we call bocce ball. I walked into one of our adult day health centers, and there was actually a game of bocce ball going on in the activity room. They were sitting in their chairs and throwing the balls, but they were having a wonderful time, and a lot of laughing was coming out of that room.
That's a good thing.
Yes.
Yeah. Now, how is it different? This is a medical model as opposed to a social model. So maybe some of the viewers have seen ads or flyers in the newsletters for the social programs that are out there.
Mm-hmm. Many of the Council on Aging, the senior centers, have a social model, adult day health, which people can come to and again join people their own age and spend the day together, enjoying activities together. The VNA has a medical model, adult day health, which means that we have a nurse, an RN, on site while the clients are there, and we are also can accept mass health, and outer services can reimburse for some of the services too. But the difference between the social and the medical model is that we actually do have an RN that is present. So we can manage medications. We can manage small dressings. If somebody has a recent cut on their arm or their leg, they don't need to stay out of the adult day center. They can come in and the nurse can do the dressing change for them. We can manage people who have diabetes, and we can test their blood sugars, where a social model really cannot do that kind of hands-on.
So it is hands-on they're able to do.
Correct, right.
So for people that may be thinking of their family member who has some of those issues, this is a more secure environment probably for them?
It is a more secure environment for people who have like cognitive issues. If somebody is needing to take medications periodically throughout the day, and they have difficulty remembering it, the nurse can remind them to take the medication. She can actually administer the medication. If someone is having a little bit of difficulty with bowel or bladder training and maybe needs to be reminded to toilet during the day, we have program aides that can actually assist and help people to go to use the lavatories. And also ambulation is another issue many times with people. They're unsafe ambulating, maybe with a walker or a cane, but maybe sometimes kind of forget a little bit that they need that walker or a cane and tend to get up without it. And because we're a medical model, we can accept people who have those various devices, and then the program aide is there to assist when they need the assistance with the ambulation. Excuse me, I'm going to cough. Excuse me.
'Tis the season.
Just right here.
Right there.
Yeah, sorry.
Oh, I should get some water. Oh well. we'll hope for the best. So,
Sorry, it's
that's
just right
okay.
there.
I think with the medical model, it leads to the perception of a safer environment than for any family members that are thinking about it.
It does. It does lead to a safer environment. Yeah. And the people come in the morning. They arrive around 8:30 in the morning, and they usually leave around 2:30, 3 o'clock in the afternoon.
Who is eligible for the program?
Almost anybody is really eligible for the program. Our programs are very much geared towards seniors.
Okay.
So we do
what
have
is a senior? So do you have a
65 and over?
Okay.
Kind of like 65 is kind of like the cutoff age, just because of the people that we have in our centers. They're usually in their 70s or maybe their 80s, depending on what their disability is.
Okay.
If it's a cognitive disability, we've had people who have been in their 50s that have been recuperating from a stroke, and they still need to have somebody that can help them and monitor them during the day. But our clientele tend to be in the 70s, the 80s, and they have one or two needs for activities of daily living. Like they need to have somebody help them with the toileting, or they have little cognitive issues.
Well, it's nice because then they're among their own age group as well. There's not a great variety of 40s to 80s.
Right, and they have so many common interests then too. So when you're talking about daily events, they many times have such wonderful stories to tell from past experiences. Like on Veterans Day, we had veterans that we were able to share some of their stories, and we do have some veterans that attend our adult day health program, especially the one in Sandwich.
What about guidelines for admissions? Are there those who can and those who can't? Or?
There are guidelines for admissions. Elder Services will sometimes, depending on the income of the person, will be able to assist with the tuition. And their nurses actually, their case managers actually, they do the intake to see if they meet certain activities of daily living requirements for that assistance and income. And then they call it leveling, but they will fill out the information forms and see if they're eligible to attend adult day health, if it's going to be reimbursed under Mass Health or if it's going to be reimbursed under an Elder Services portion. But other than that, there is no really admission criteria. If someone is going to pay privately and maybe doesn't fall into that Mass Health category or isn't going to be eligible for some elder service assistance and they're going to just be paying privately, they just really need to come and see the program and see that this is something that they fit in the program. And many times it's the family member bringing the individual to the program. And we always offer a visit first to come and just evaluate and see the comfort level, and if you feel like you kind of fit with the rest of the group that's there too.
Right.
And sometimes we have had experiences where we have had people who really were not too keen on coming to the program, and maybe it's because it's called an adult day health center and they maybe feel like they really don't need that then. But once they get there and they maybe stay a couple of weeks, they want to increase the amount of days that they're there because they're really enjoying it and they're enjoying the company and the camaraderie of the other people.
Right. So what are the objectives of a day health center for the client, say?
The objective for a day health center is really socialization and safety. Maybe you put safety first. But people many times are not able, they can stay at home in the community and they do not need to be in a nursing home, or they have family that maybe needs to work during the day. And if they're home, they're alone because they can no longer get outside. Maybe they can no longer drive. Maybe their ambulation's a little impaired. So they're really kind of homebound and housebound.
Isolated.
And isolated. So it's that socialization and staying really in touch with other people very much who have the same interests as them. And then that safety. If somebody has some cognitive disabilities and maybe isn't really capable of making safe decisions as far as like going down the cellar stairs or taking that medication that they need to make, then there's somebody else that can help them and remind them and help them to stay safe so they don't have that fall. that they could very easily have
Right.
if they were alone at home.
Otherwise, the temptation for the family is someone needs to stay home with them,
Right.
or the next step would be they'd end up in a nursing home.
Nursing home,
probably.
right. And many people, you know, there is a place for nursing homes, for long-term care
Right.
facilities, but many people who come to our adult day health centers really, this
Aren't
is
ready
really,
for
they're not
that.
ready for that yet.
Yeah.
So this is a really good alternative for
Right.
them so that they can remain active and healthy in the community. And we had an example of a man who actually his sister had offered to have him come live with her, but she had to work, and he was an elder, and his only option would have been to go live with his sister or to go into a long-term care facility. So he came to live with his sister, and she had him enrolled in our adult day health program, and he was pretty non-communicable when he first came in. He would just kind of sit and be quiet in the corner and not really interact too much. But within a couple of weeks, he was the center of the crowd, and he was into the program, and he really looked forward to coming.
I bet.
So I think many people find that in the beginning they're a little hesitant, but like once they get there and they meet the other participants, they just join right in.
Sure. It's like the new kid in school. You know, I
Yes.
don't know anybody else here,
Right.
and they've all been here before me.
Right.
Right.
Yes.
Now, I know you've mentioned a few things of the activities,
Mm-hmm.
and I've actually stopped into the center and seen some of the fun they have myself. So let's talk about that a little bit. I know you said bocce, but do they have a daily routine of review the news maybe, or?
Yes, they do. Right. They have an activity calendar, and we have an activities director at each
At
center.
each site? Okay.
And they develop an activity calendar for the month. And they plan this out according to what's going on in the month. And we have live entertainment. We have
Like?
well, music.
Oh, okay. Okay.
We had a magician once come in.
A magician would be
yes,
good.
we did.
Yeah.
We did have a magician once come in, but it's usually music.
Music, okay.
So there's usually singers, and they come in with their music. And we've had a couple of times we've had school children come in and do a
nice.
little performance, especially around the holidays. They like to do that. We have therapy dogs
Oh, nice.
that visit I think on an every other week basis they visit now, and the clients love
Is that
the therapy
popular? I
dogs
bet.
too. Yes. Yeah, it is very popular, and I believe they go to both centers as
Oh,
well.
yeah.
And then they begin their morning with current events.
Okay.
When they first arrive, they have like a little bit of a toast or a pastry or something healthy, and something warm to drink. And then they begin with the current events. So the activity director and the program aide and the nurse, they review what's going on. And of course we try to keep it age specific. So like on Veterans Day, that was a big current event, or anything big that's happening out in the world.
And it's interactive,
it's
so it's
very
not just
interactive.
the activities director standing there saying, this is what's happened today, or
Right.
10 years ago, or
Right,
today.
and everything is participatory.
Okay.
Then nobody's being like talked to.
Yes.
Everybody is being encouraged to participate. And then they might have, a little music come in, or they could be doing a trivia game, or they could be doing the bowling or the bocce ball, and they have a hot lunch. And it is a nice, well-balanced hot lunch. We use JML for the trade winds, so they're used to preparing these hot lunches. And
So
we
that's
use
down on
Epic
the sandwich end of the world.
sandwich.
Okay.
And then in the Harwich end, we use Epic of Brewster,
Oh, nice.
and their kitchen prepares our meals for us. So they're appropriately
Yes.
prepared, and we watch diets too, because we can handle special diets
Oh,
as
good.
well.
Good to know. Yeah.
So, and then in the afternoon, they again, there's more activities. Nobody sits and watches the TV unless the inauguration is going on, something big like that.
Something big.
Nobody watches
Macy's
the
Day Parade. Yeah.
Right, right. Nobody watches the TV. And by the time they're ready, the bus comes to pick them up, or their family member comes in to pick them up, they're good and tired because
yeah.
we haven't allowed them to sleep.
Yes.
And they go home and they have a good night.
Yeah.
So it's also good for that too. Some people have problems sleeping at night.
Yeah.
So if they have activities during the day and they're engaged during the day.
Do you hear
they're
that? I
gonna
bet that's their best night's sleep.
They sleep better at night.
Yeah.
They do. Yes. So
Now, how often do people attend?
they can attend 2 days a week. They can attend 5 days a week. We kind of don't recommend that they only do 1 day a week because
Okay.
it doesn't give them enough of an experience to really get in touch with the rest of the group that's there.
Right.
But so they usually come between 2 and 5, and I think the majority are like 3 days a week.
Okay.
It is a full day session now. We don't do half day sessions.
Okay. Now, how do they get there? Is it, I know you had mentioned bus or family, are there other?
Right. We have contracts with the B bus, and the B bus does go door to door, and they will pick people up and they'll bring them to us. And these are, licensed, certified drivers. So, and the B bus is a handicap bus, so they can handle the wheelchairs or a walker, and they assist clients in and off the bus and into the facility, into the center. And we also have our contract with Wheelchair Transit, if somebody really does need to have that type of transportation. And then family members will bring them as well.
Okay. Now, the admission process, is there a complicated process for that, or is it a sit down, fill out some paperwork? Like you had mentioned, do a site visit with the family?
Really recommend that the person come in and do a site visit. And actually, many times what will happen with an admission process, the family member will come first. And they really want to see the facility, they want to see the activities going on, and then they want to get their questions answered. So that usually starts the admission process, and there is a little tiny bit of paperwork depending on how it's going to be funded. If we're really looking to have it funded by Mass Health, then there is a screening tool that needs to be completed by the elder service case manager. So that many times has to happen as well. They make home visits to do that.
Okay.
But then we ask for the participant to come.
Oh,
And actually they come and we do an interview. And we do an assessment and we show them what's going on and what the facility is like and who the people are there and what their day is going to be like. And in the meantime, the nurse is really making her assessment to see if this is going to be a good fit. Because we really do want to have people that work well together. You want to have, you want to make sure you take care of the whole and the individual too. And sometimes the nurse really has to make that decision by actually seeing the person and seeing this is going to be a good fit within the group that she has attending now. And sometimes that also makes a difference on the days that are offered, because if a gentleman is coming in and we know that we have many more gentlemen on a Tuesday, Thursday, this might be and they would be very good together, this might be something that we can suggest. Or if it's somebody that has maybe special needs, and we know that we can, we have that kind of a group on another day, so we can make those suggestions. So we try to make it really individual to the participant. We do ask that they get a physical from the doctor. We do ask that the doctor sign off, and the doctor say that yes, this person can attend.
That it's okay for them to come.
Right, we do ask for that. Right. Yeah. But that usually it's not an in-depth physical, and most of the time the person has already been to the doctor, so the doctor can fill out the forms.
So you know that ahead of time. Yeah.
Right.
And you've had couples before.
Yes, we have had couples, and that was really fun to have couples too.
It's just an interesting tidbit for viewers to know if you have more than one or think that that's an idea. That's certainly a possibility.
And we've had couples, and we've also had one spouse attend and the other spouse volunteer.
Oh, nice.
To come in, so that they're still together.
Yes.
And so we can accommodate a variety of relationships there. Right. Yeah.
Well, would you talk a little bit about the value of this kind of program for the caregiver? Because we're hearing all the wonderful things, how it benefits the client themselves. But for the person that maybe was faced with keeping this loved one at home and with the isolation or the safety issues, must be such a load off their mind.
It gives the caregiver that opportunity to run those errands that they really maybe could not do if they had to have their loved one with them.
Right.
It just gives them that little bit more freedom, and it does take the stress, some of the stress off of the caregiver. And we talk a lot about families who have to work, but we also have spouses who are caring for each other, and one spouse is a little sicker than the other spouse. So it relieves that other spouse, and maybe that other spouse then can go and do that golf that they like to do, or go and do the bridge club that they like to do, because they know that their partner is being taken care of.
Right.
So it just gives them that little bit of freedom for those few hours.
Yes.
So it's very beneficial to
And
the
they
caregivers.
know they're in a safe environment where they're well cared for.
Right, and yes.
That would be hard.
Right,
Yeah.
and we always contact them. We always have their phone numbers so that if something does arise, we can always give them a call and
Okay.
get them up to date on what's happening.
Yes.
We run a caregiver support group in our Sandwich site,
Oh, wow.
so which is very successful too.
Okay. Now, there are 2 sites,
Yes,
one in Sandwich, one in Harwich.
correct.
Are they pretty much the same as one another, or?
The program itself is the same, and we do try to make our programs very individual to the clients who are attending. But everybody, as I explained, you know, when they arrive, they get they have a little light breakfast, they have their hot meal. We have activities all throughout the day. There's a nurse at both sites, so they are pretty much the same.
Okay.
One program is a little bigger than another program.
Is
The
it? Yeah.
Harwich site has, we can have a capacity of about 18 people
Okay.
at the Harwich site, and we have a capacity of 30 people
Oh, in
at the
Sandwich.
Sandwich site. So
Okay.
it's just a little bit bigger facility.
Do you have, is there a geographical line on the Cape where that's drawn and people from here go to that one and people from here go to that one?
There is, and it's usually Yarmouth.
Is that right? Yeah.
Yes. And again, some of it we're constricted by the Mass Health regulations. If you are a Mass Health client and you want Mass Health to pay for this, then we do have to get a waiver for transportation if you live in Yarmouth and you want to come to the Harwich site. So there's a little bit of maneuvering around you to do that. But they can go to either site, depends on how far they want to travel. It's really difficult for someone to be on a bus, though, for more than an hour.
Yeah.
So coming from Provincetown to Harwich is not probably something that's going to
Right.
work.
But for viewers anyway, they need to just know that you'll help them shuffle through all the paper that needs to be done to
Yes,
get
we
them
do.
there
We
and
help them
figure
with
all
it
that
all.
out, so
We
no
have
worries.
We have a social worker, too.
Oh, okay.
That definitely helps
That
them with
knows all the ins and
transportation.
outs of that. Now, does health insurance or long-term care insurance cover some of this? Depends on,
Right. Depends on your
program?
policy.
Okay.
Long-term care does cover adult day health.
Okay.
And long-term care covers medical model adult day health usually. So this is the program that they cover when they talk about covering adult day health. And what the person does is they just contact their case manager at the long-term care company, and we actually have to bill the person, and then they get reimbursed from their
insurance
insurance company.
Okay.
But some long-term health insurance companies really have a very good benefit for adult day health.
nice. Right. So for people that are interested, there's kind of 3 options. It's private pay, it's out of pocket, and certainly that's easy breezy. Then it's check with your long-term care insurance if you have it to
Right.
see if it's covered.
Right.
And then adult day or elder services can help with Medicaid,
Right.
Mass Health, any of those.
That's right.
Okay.
Right.
All right.
So
Now, do you need volunteers at the program?
we always need volunteers.
Let's put in a pitch for volunteering.
Yes, we
Yes.
always need volunteers. If anybody's really interested in this kind of a program, it's always good just to come and look at it first.
Yes.
But yes, we do, and we use VNA volunteers. So
Okay.
our volunteers really sign up with the VNA.
So they could run through the VNA volunteer program and get okayed there,
Right.
and then they're good to go.
Right. And I've gone
What
into...
would they do? I'm sorry. yeah.
Okay, well, what they do, they help with the activities. They're
Oh,
not
all
going to
right.
be doing anything hands-on. They don't need to worry that they might have to help somebody go to the bathroom or
Right.
something like that. And they really don't even help when we're using a walker. We really need our program mates to help with that for safety reasons. But they do a lot of activities, and they do a lot of conversation. And we actually had. I was in one of the programs, and we had this woman who was singing, and the participants wanted to get up and dance, and one of our volunteers was there, and you're dancing, with the participant, and it's fun, and there's a lot of laughing that goes on.
Yeah.
They might even just be joining in on getting that puzzle solved, or joining in and maybe playing that card game that somebody wants
yeah.
to play. So
Just another set of hands for the activity piece of the work.
Right.
Yeah.
Right. And it's working with the people. It's not, sitting in a corner and doing something
Directing,
different.
right,
Yeah.
right.
You're really engaged. So it's
So are you
it's
looking
a
for
fun
any
program.
like creative types or musical types? Anything?
I'll
We'll take
take
it.
anything.
I
I'd
know
love
it-
to have some musicians volunteer
Oh,
too.
yeah.
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 But anybody, we all have talents. We've got people who paint. We have people who have arts, to do arts and crafts kind of things
Right.
that have that, and we're always looking for activities to bring in. So
Great.
always use a volunteer
People, if they're interested, right?
if they're interested, right?
So we only have about a minute left, if you can believe it. I just wonder, have we touched on everything for Adult Day Health? Anything else viewers might need to know about how great the program is, how easy it is to get into?
Okay. It's really easy to get into, but I think the most important thing for people to think about is to stop by and see it. We're in Harwich off of Route 137. We're in the Dunkin'. Funny because we're in the Dunkin' Donuts Plaza there, but we're kind of in the back. But there is a little sign that says V&A Adult Day Health. And in Sandwich, we're also in a Dunkin' Donuts Plaza. We
Conveniently located near a
conveniently
Dunkin'
locate, yeah, and that is in the Tradewinds Plaza.
Okay.
And they can just stop in, and the nurses and the staff, they're always willing to have somebody just stop in and sort
Okay,
of
so
check
no
it
need to
out.
call for an appointment if they happen to be in the neighborhood.
If they happen in the neighborhood,
knock
stop
on the
in
door
and
and
see
take a
it.
peek.
Right.
All right.
Yes.
And if people want more information, they could call the 800 number?
Yes, they can. They can call the V&A 800 number. That's what 1-800
631 3900.
3900,
1-800-631 3900.
Right, and just ask for the Adult Day Health Program, and they'll be transferred.
Connect to all sites.
Yes.
Well, very good. Thanks, Mary, for helping us out here today and being all knowing of the Adult Day Health. I appreciate your time.
Thank you for having me, Jean.
All right. And I'm Jean Sarnowski, wishing you good health and good health care.